I'm Dr. Sharat, Chief Consultant Plastic Surgeon at Arete Hospitals, Hyderabad. I wish to speak to you today about body contouring, which is an interesting topic by itself, and I'd like to cover it in a short divisions of head and neck, trunk and limbs. If you take head and neck, body contouring, when you want to correct effects of age and laxity of the cheek area, nasolabial folds and neck folds, a lift, you must have heard about facelift and a neck lift. So that means you trim back the excess skin, the incisions in the skin crease when there is a surgical intervention, usually done by a plastic surgeon. If there is a conservative method, that is through threads, which people do lifts, but again the threads have the disadvantage of the skin being tucked. When you pull it back, it folds up at the creases in front of the ear or the neck area. Eye bags can also be corrected in facial rejuvenation, and brow lift is also useful to take down the folds of the forehead or ptosis of the eyebrows. So the lift happens in the junction between the skin crease and on the top end where the border of the hair and the skin junction is there. Endoscopic brow lift or brow lift happens again through the incisions in the hairline. The brows are upwards and hitched into the bone, frontal bone there through non-absorbable stitches. It is a daycare procedure done under general anesthesia. Sometimes local anesthesia can be useful for neck lift or facelift if it is skin only approach, or a brow lift also. And coming to body contouring can be divided into arm lift, thigh lift. Arm lift is brachioplasty, thigh lift or thigh contouring, upper limb contouring. If there is a lot of fat in the arms or the legs, you do a liposuction, and if there is laxity of the skin, you do the excess skin trimming, or it can be a combination of both. For trunk, abdominoplasty, wherein loose skin and fat removal is done, and if there is any associated hernia, that is also corrected. For breasts, if there are loose breasts or misshapen breasts, you can lift them up, and if breasts are hypoplastic or smaller or asymmetric, they can be corrected. Hypoplastic breasts by means of implants or lipofilling, and if there is an enlarged breast, you can correct them by reduction. Usually breasts which are saggy downwards, mastopexy is useful by bringing them upwards. And plastic surgery opinion would be useful for body contouring to see appropriate liposuction at areas which are heavier, and conserving aesthetically appearing shape, and correction of different lax areas can be done and useful to that individual.